Okay, I think we'll get started. Hello, everyone, and welcome to our 2023 Neurosarcoidosis Patient Day. I'm Leo, and I'm the Senior Executive here at Sarcoidosis UK. I do hope you're all keeping well. Thank you all so much for joining this important annual event. We always really enjoy this event, and I think this is now actually our fifth Neurosarcoidosis Patient Day, which is very exciting. And if you haven't seen any of our previous patient days, or you'd simply like to rewatch them, you can do that on our Patient Day Hub on our website. It contains all of the recordings and transcripts of our previous events. And there really is lots of useful video resources there. So do take a look at that when you're able to. Now, as many of you will know, our Neurosarcoidosis Patient Day is usually hosted with Dr. Kidd, but he wasn't able to join this year, but he did want to say hello. So he's recorded a brief message to introduce the day and to say hello to everyone. So I will play that now.
Hello, everyone, and welcome to the annual Neurosarcoidosis Patient Day, the fifth one that Sarcoidosis UK has funded and run. We're very pleased with the work that they have done to help with this over the years, particularly the help that Leo puts in and Jackie Newton as well with the IT interfaces and the dissemination of information both before and after. I think this is going to be a fantastic event. We've got four excellent and very experienced neurologists who are going to explain the disease and the symptoms that it may cause, the investigations required, and the treatment available. Those of you who attend the NHS in England will know that we've undergone rather major changes over the past year. The health service has changed a lot in the past 5 years, and the concept of centres of excellence and experience in the investigation of and treatment of rare diseases is not really supported any more, regrettably. And obviously there are a lot of financial reasons for that within the running of the health service. So working within the confines of these changes, we've developed a network which will allow patients with rare inflammatory diseases such as neurosarcoidosis to gain access to clinicians who have the appropriate level of interest and experience in the diseases that the patients may have. And they will be in each of the main regions of the UK. So, for example, in England, there are 10 regions: Northwest, Northeast, Central West, Central East, and so on. And at present, we've got 1 or 2 clinicians within each of the regions who are interested and available to see patients with symptoms which may lead to the diagnosis of neurosarcoidosis or an alternative diagnosis or illness. We meet once a month, and we're developing clinical databases, research projects which will investigate the diseases further. And we've developed or strengthened links with non-neurologists interested in inflammatory diseases throughout the country, and also with neurologists in England, in Scotland, and in Wales. In addition to research which will lead to a greater understanding of the diseases and their treatment, the network is available to all other neurologists for consultation on patients with complicated inflammatory diseases. Patients can be referred in a virtual way, rather like we used to do whenever I was at the Royal Free, in which the clinical details are presented, the investigation results described, and the scans looked at by our own specialist neuroradiologist. The experts present then discuss the symptoms, recommend further tests or a change in treatment, or agree with the diagnosis and the treatment already envisaged. In this way, patients with rare diseases can be helped either directly or virtually by a network of highly specialized and experienced neurologists, some of whom are experts in sarcoidosis and neurosarcoidosis. Others are more expert in vasculitis or in neuromyelitis optica, variants of multiple sclerosis, which can often simulate conditions like neurosarcoidosis. So I'm delighted to say that 4 of those within the network are here to talk to you today, to answer any questions that you may have, and I'm absolutely certain that it will be a terrific meeting. I wanted finally to acknowledge and thank, both for my own part, but also on your behalf, the extraordinary work that Jackie Newton has put in, helping you understand the disease, aiding your quest for treatment and answers. The work she puts in behind the scenes is extraordinary. You won't need me to remind you that she even takes her Facebook work with her on holidays, whilst whilst battling the effects of the disease and its treatment herself. She deserves thanks, praise, and also a rest, and I do hope that others will be able to assist her and take over the work that she has done and maintain the high standard that she has performed over the years. That's it for me. As they say over here, Slán live agus banach dorif galer. Slán.
So thank you very much to Dr. Kidd for sharing that and for all of his support with these events over the years. And I absolutely wholeheartedly echo his comments about Jackie Newton, who is a trustee of the charity and our patient ambassador. And she really does so much for this community when it comes to sharing information or making sure people get the support that they need. So a really big thank you to Jackie. And I think she is here on the call today as well. As Dr. Kidd said, we have some really excellent neurologists presenting today, and we're really lucky to have them. So I want to tell you a little bit about each of them before we go through the programme and see what we have in store for the day. So we are really honoured to be joined by Dr. Taranya Aaron, Dr. Claire Rice, Dr. Peter Fernandez, and Dr. Victoria Singh Corey. And I just want to tell you a little bit about each of them. So Dr. Aaron is consultant MS neurologist and the research lead for neurology at the University Hospitals of Coventry and Warwickshire. She has a special interest in neuroinflammatory disease, and she is the chair of the Neuroinflammatory Specialist Interest Group of the Association of British Neurologists. Her research interests include multiple sclerosis treatments and imaging and neurosarcoidosis. We also have Dr. Claire Rice, who is an associate professor in neuroinflammation and honorary consultant neurologist at Bristol Medical School, University of Bristol, and North Bristol NHS Trust. She works with the MS team at the Bristol and Avon MS unit and runs a specialist clinic in neuroinflammatory disease at Southmead Hospital. Her research centres on understanding the role of bone marrow microenvironment in neuroinflammatory disease. Dr. Rice also contributes to a number of undergraduate and postgraduate courses at the University of Bristol and is Deputy School Education Director for Bristol Medical School. We're also very lucky to have Dr. Peter Fernandez with us, who studied at Oxford before moving to Edinburgh for specialist training in neurology, completing a PhD along the way. He relocated to Hampshire in 2021 to take up a post as consultant neurologist in Southampton General Hospital, with a subspecialty interest in multiple sclerosis, neurosarcoidosis, and other neuroinflammatory conditions. And last, but by no means least at all, we have Dr. Victoria Singh Corey, who is a neurologist specialising in neuroinflammatory disorders, including neurosarcoidosis. She works at Chelsea and Westminster Hospital, Charing Cross Hospital, and she also runs the Joint Neurology Sarcoidosis Clinic at the Royal Brompton Hospital. So as you can see, we have some really fantastic speakers today, and we really look forward to hearing from each of them very shortly. I will quickly show you the programme. So following my introduction, Dr. Fernandez will give his presentation on pathophysiology, which will be followed by Dr. Singh Corey's talk on clinical manifestations of neurosarcoidosis. We will then take a short break, and after that, we'll hear Dr. Aaron's talk on management of neurosarcoidosis, which will be followed by Dr. Rice's talk on future developments. Then after a final 10-minute break, we will have our Q&A, where we'll be asking the speakers your questions. As always, we've had some questions sent in advance, and you can also submit your questions throughout the event too. So at the bottom of your Zoom screens, you should see both a Q&A button and a chat button. If you want to submit questions for the Q&A, please do put them in the Q&A box rather than the question box. Rather than the chat box. The Q&A box rather than the chat box just makes things slightly easier for us to have all the questions in one place. And we'll try and get through as many of your questions as we can during the Q&A at the end. Now, before we get started with our sessions, which is what I know we're all here for, I do just quickly want to touch on the ways that Sarcoidosis UK might be able to support you with your neurosarcoidosis. We have lots of great resources that could help inform you about the condition, but also provide support as well. So if it is information that you need, our website is a really great place to start. We have detailed information pages on neurosarcoidosis, as well as leaflets, which are free to order or download. We also do have lots of information videos, and as I mentioned before, all of our previous neurosarcoidosis days are recorded and uploaded and transcribed. So if you are interested in learning more about your condition, please do take a look at those. We also have a consultant directory on the website, which we have been updating this year. It's a growing database of known specialists across the UK. So if you do need help finding a neurologist, or you're looking for a referral to a neurologist, have a look at the consultant directory or get in touch with us in the office, and we'd be happy to help too. And I also want to make sure that everybody is aware of the support services that we have at Sarcoidosis UK. A fantastic source of support is our network of Sarcoidosis UK support groups, and they run in different locations around the UK. And they're a great opportunity to meet with others who are affected by sarcoidosis, and learn from each other and share experiences. And some of our groups meet on Zoom, whereas others meet in person. And so if you would like to hear a bit more about our support groups, or maybe join your local group, do have a look on our website, or again, give us a call as well, and we're always happy to help. If you do prefer online support, I can also recommend our Facebook groups. Our main Facebook group has over 7,000 members now, and our Neuro group has nearly 1,500 members. And I do have to say, they really are such supportive and welcoming communities. So if you would like to connect with other people who will understand what you're going through, please do feel free to join. We'd be very happy to have you. And as I said, they are such welcoming communities, and our members do really provide really helpful information and advice to others. We also provide support through our Sarcoidosis UK Nurse helpline. This is a free and confidential telephone helpline, and all of our calls are taken by our 3 amazing Sarcoidosis UK nurses, who have either personal or professional experience of sarcoidosis. You'll see Nurse Rachel in the top right of my screen there. But if you would like some extra support, do get in touch with us in the office and we'll schedule a call for you, or you can also request a call back through our website as well. Okay, we are going to be starting our session, our first session, very shortly, but just a few final things from me. Firstly, as I've said, do get in touch with us if you require any support with your sarcoidosis. We are here to help in any way that we can. We're a very friendly team, so do get in touch if there's anything we can do to help. Secondly, we are a very small charity. We're a team of just 3 in the office, and we don't receive any government funding, so none of our work is possible without the support of our amazing donors and our brilliant fundraisers. So if you are able to, please do consider making a donation to Sarcoidosis UK. You can do that at sarcoidosisuk.org/donate, and we really are incredibly grateful to anyone who can support us in this way. And finally, just a couple of thank yous. First of all, thank you to Eva, who I don't think you'll see on the screen today, but she's working very hard in the background to run this webinar. She's given up her weekend to make this possible, so a big thank you to her. Thank you to our speakers for giving up their time to share their expertise with us today. We feel very lucky to have you here with us, and we're very grateful to have you. Thank you as well to everyone who is watching along with us today. Please do get involved, ask questions. We're really happy that you're here, and I hope that you find today helpful and informative. Anyway, I think that's actually enough from me, and we'll get started with our first session of the day.